Welcome to Homebound Hernandez, episode 4. I'm not gonna lie, we're a little bit devoid of creative ideas, so we're gonna go ahead and fill you in on from the front lines of what is happening with the coronavirus, COVID-19. So, Cam, will you tell everyone what you do?
I'm going to work today, which means I'm going to the emergency department.
Okay, what do you do in the emergency department?
I'm a PA.
Which means what?
Physician assistant.
Which means what? What do you do?
Basically I see patients and evaluate them, and I order tests and like x-rays and labs, and then I interpret all of them, and then I tell people, hey, this is what's going on, and you need to stay in the hospital, or hey, this is what I think is going on, I think you're fine, you should go home and follow up with the primary care doctor.
Okay,
so I'm the person you see if you check into the ED.
Okay, so what is different about the hospital this week compared to what it usually is like?
It is extremely different because we're having to divide the department into basically a clean side and a dirty side, which means all the respiratory patients that might have COVID-19 on one side, and then everyone else on the other side. Because what is tough about this is emergency medicine just doesn't stop because COVID-19 is here, so we're having to deal with all of our normal abdominal pain, surgery patients, heart attacks, strokes, that sort of stuff, as well as all this stuff that comes from COVID-19, sick patients from that too. So it's easier just to divide the department. It's taking a lot longer to see people because we have to put on what's called PPE. So personal protective equipment. So those are N95 masks for some people. Other people, it's going to be surgical masks, a gown, gloves, goggles, a face mask or a face shield, something like that. And so that's kind of actually it takes a long time to put all that on. It's called donning, but and take it off.
D-A-W-N.
Yeah. They say don and doff, which is a goofy. It's just a goofy word. But that's actually the big deal right now for the public is not to hoard unnecessary masks, because almost no one needs a mask unless you're symptomatic or unless you're a healthcare provider taking care of someone that is sick. And so it is we have protocols in place, but literally it will change probably, when I'm on shift for 10 hours, it'll change 2 or 3 times, because it's okay, we just ran out of N95s. So you just have to do what you can to take care of patients. It doesn't mean we stop taking care of patients, but it means that we're less protected. So,
why should people be social distancing?
Basically, the coronavirus, it's just super virulent. So it means it's way more easily spread than influenza or rhinovirus or RSV, which are other upper respiratory illnesses. And so it's the infection rate of the amount of people that one person with the disease can infect is very high compared to the other illnesses. And it's really important on a broad spectrum scale that we don't flood our healthcare system, basically our emergency departments and our hospitals, with sick patients all at once. So we're trying to slow the spread so that not everyone needs healthcare at the same time. And that's why it's really important as a young person who actually, if you're in your teens or your 20s, you're one of the most likely groups to have the infection and not have symptoms. So you don't know.
So you're passing.
So
you would,
you would unknowingly pass it along, more so than people in their 30s, 40s, or even 50s. So, and that's really bad. So we're trying to dampen kind of the influx of patients that come into the ED, because we just can't handle it. And that's what they're seeing in Italy too.
When should someone go to the ER if they think they have COVID-19?
Yeah, so if you think you have COVID-19, but you're managing, you are sick, but doing your, drinking lots of Gatorade or water at home and taking your Tylenol and doing okay, then you can always call the Indiana State Department of Health has a hotline that you can call for potential testing. But otherwise, if you're not dying, you should stay home. Because there's nothing that I can do for you when you come to the ED, really. In terms of coronavirus, there's no cure, there's no pill. I do anything special for you. So unless you're dying, you develop like severe shortness of breath, and certainly that's going to be worse if you have like an underlying disease like asthma or something like that. But so basically you should come if you like think that you like may not survive. But definitely screen your emergency department visits wisely. Like this is not the time to probably get that rash. If you're going to get things like checked out at all, probably not the time. Like if you want that rash checked out that's been there for a couple weeks, or like you're need a refill on your medications, or maybe you tripped and sprained your ankle and it's just like hurting you a little bit, but you're still walking, like probably not the time. It would be much appreciated from our standpoint that we take care of patients that are really sick.
Okay, my last question is, when do you use Algebra 2 at your job?
It's more like I
When
use
don't
Algebra
you?
2 to get to my job, because I had to have a college degree to do my job, and in order to get to college, I had to have a high school diploma, and Algebra 2 is required to get a high school diploma. So it is
Spoken like a spouse of an Algebra 2 teacher.
it is not the end, but it is a means to an end. So yeah, so you got to do your Math Excel, and what else do we do? And not use PhotoMath. Please don't use PhotoMath. There are PhotoMath in this home causes a lot of strife. We don't like PhotoMath.
So stay safe. Here's Sammy. Bye, guys.
Thanks, guys.